Lanark County has launched a mobile clinic to meet people in need wherever they may be.
The familiar faces, what makes my day sometimes.
Raw North is an example of how the Lanark Integrated Frontline Team helps. Since December, they've been reaching out to people in precarious housing situations.
Oh, I was in rough shape. I wasn't associating with anybody. I wasn't going out except for to take the dogs out. I just didn't do nothing. I was a vegetable. But now that these kind folks have come around and helped me so much, I feel I owe it to them to get as better as I can.
The Smiths Falls man says they provided him social connection, medical care, and help navigating support programs, all out of the back of a converted Lanark County ambulance, bringing together a paramedic, social worker, and a nurse practitioner.
I don't know if you noticed, but this thing is packed to the gills.
This is our mobile clinic where we meet with a lot of clients. We'll meet them in front of their home or maybe on the side of the street or at an encampment.
Supplies include snacks and tick removal kits for those living rough, but also naloxone, drug testing kits, and other medical equipment.
Part of LIFT's goal is to build trust for people who have fallen through the cracks in the system so that they'll feel comfortable getting the supports they need, whether it's social housing or medical care.
A lot of the folks that we meet are not people that I've seen on the 911 side. They actually try to avoid medical care. So to build trust with a small team like us and find that we meet their needs is good. We try to be like a one-stop shop. Whether you need help with your rent or you need a heart test, we can do it for you.
Helping people do their taxes, right? The census that just recently came out is another thing that we help people do a lot of the time. IDs, starting with the birth certificate, going up to the health card and the Ontario ID. You know, a lot of people don't know how difficult life can be when you don't have your IDs.
Instead of turning to an ER for primary care needs, clients have access to the nurse practitioner.
I'm able to try and catch them. It could be 10 years later, 5 years later, or even last month that they've lost their primary care. And then I'll try and connect them with someone in the area.
The county has funded the LIFT pilot for 2 years using a Health Canada grant with the hope of expanding to a second team. Matthew Kupfer, CBC News, Carleton Place.